Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And the subject of the broadcast is why prayer is important, with the focus on addiction. And the reason that I wanted to share this is because of an patient encounter that I had today that highlighted the significance of this for me once again. So I approach my patient care with a whole person health approach strategy. This is sometimes called holistic medicine. And I've been doing this for a lot of years. And so spiritual health is important to me. And I think that all people can bring to the table assets from their physical, their emotional, and their spiritual spheres of their being to help them be more healthy. And one of the most powerful places where this happens is in situations where people are dealing with addiction. And the story of the 12-step program is probably the best way to illustrate how powerful this is. And 12-step program, a lot of people heard of, AA or Alcoholics Anonymous, is a real old program now. There have been various spin-offs on the strategy, but basically, Alcoholics Anonymous, as a 12-step program, developed as a Christian program. And then it was sort of changed in a little bit to use wording so that people who are not Christian could also feel comfortable in the meetings. I remember when I was in medical school, learning about a lot of different things as we transitioned from the basic sciences part of medical school to actual clinical practice, and learning the different parts of examining patients and making the diagnosis and treatment and things like that. We had this sort of a session that went on between these two stages of working with books and all of the science and working with people, that they brought in different specialists to teach us about relevant things that we're going to encounter. And one of the things that was a big subject was addiction. And addiction has always been a big subject because it's been with us as long as there have been addictive substances. So they had a couple of people that were basically professors and very knowledgeable on the subject. They came in and lectured to the medical students, and you could tell that everybody was just falling asleep. There was no interest really in what was being shared because it was too cerebral. It didn't really connect with anybody. Nobody wanted to hear these series of facts. They wanted to understand how does this apply to people. And so the next part of that section, though, they introduced 3 different people who were members of Alcoholics Anonymous. And they shared from the heart their experiences with addiction. And they, as they shared from the heart, you could tell the whole room, the whole entire medical school class basically woke up and became alert, attentive. There was sort of an electricity in the air because these folks were talking about the real deal, life and death stuff, things that changed people's lives in a dramatic way. And basically what it came down to is that prayer makes a huge difference. Now, how people pray, it's different from person to person. And I'm not here to tell you how you should pray. I'm telling you what I've learned. And as a Christian, I pray in the name of Jesus for these different patients that I encounter on a daily basis. And today I encountered a person who has been dealing with addiction for a lot of years, even though the person is relatively young. A year ago, I saw this person, and there was not a readiness yet to leave the addiction. But now there was some shifts going on, much more suffering as a result of the addiction. And so as we talked about options, the patient sort of hinted that maybe there was some readiness to make some movement, but not quite yet. So I asked the patient whether prayer would be desired, and this patient did give yes permission. So when we prayed, you could sense that there was a shift that happened, First of all, the big shift was the eagerness to pray compared to a year ago. And the second of all, there was something that happened, and immediately afterwards, the patient pulled out a notebook and ripped out a piece of paper from the notebook. And I could see that this was a journal that the patient was working with, and that I had actually been given a page from the journal. And without any words, folded it up, gave it to me, couldn't really explain why, just that it was clear that this patient wanted me to read this journal page. So I read it in detail after the patient left, and we'd made some plans for the next encounter and what other things that needed to be attended to. And really struck me how much was insight this person had into their addiction, and where they had come from, not wanting to believe in God, not wanting to believe in anything really, because it was too constraining. That's what the big lie that this person had been living with, and many people with addictions live with. Many people in general nowadays live with the idea that if I believe in something, if I believe in God, I'm going to have a restricted freedom to do things. But this person, as the journal entry progressed, realized and talks about how what had really happened was the addiction had taken all freedom away, and that this person was crying out for some way back to freedom. And I'm telling you today that the way back to freedom is through God, and I believe through Jesus. Jesus freed lots of people from evil forces when he walked the earth, and he still does. And he does it through a lot of different ministries. He still does it through the 12-step program. And so my encouragement to you is that if you're dealing with an addiction, counseling is fine. Having support is fine. But plug into something where there is significant spiritual encounter for you. Because if you don't address this issue in a whole person health approach, where the spiritual life, the spiritual part of your life is foundational, the chance of you getting better and staying better is a whole lot lower than it otherwise would be. I'm not going to say it's impossible to recover without having an encounter with God, but it's a whole lot harder. Just this patient encounter today brought me back a lot of decades now and years to when I had this medical school encounter with these 12-step people who taught us how critical it was to meet reality, to be real, and to be real about your need for the love of God to touch me moment by moment if I want to be freed from the addiction. So I hope you found this as an encouragement to move forward with whatever is holding you back. A lot of addictions are not just drugs and alcohol. We're addicted to bread, to sweets, to bad relationships, to all kinds of ways of living that are self-destructive. And newest on the list are all the electronic addictions. So there's lots of different addictions out there that we need to get freed from, and turning things over to God, to Jesus, letting go, and turning it over, surrendering, saying, I don't have the strength to do this. I need your help. First step. Yeah, you have to admit you're helpless. You have to admit you're helpless before you can move forward. And then when you admit that, then you're ready to move forward. Until then, you're living in denial. We're living in denial. So I hope you found this encouraging and helpful. I encourage you to move forward with whatever is holding you back. God bless and have a great day.